Hello and good afternoon.
Good afternoon, sir.
Can you see my screen?
Yes, sir.
Yes, sir.
Okay, today our topic is inflammatory myopathy. So, what is inflammatory myopathy? Let's see. Before going to inflammatory myopathy, let us know what is myopathy. Myopathy is any abnormality of the muscle, and it is especially characterized by muscle weakness. So, be it proximal muscle weakness or distal muscle weakness, any specific muscle weakness, anything, any muscle weakness or muscle atrophy, it's myopathy, any pathology of the muscle or muscle fibers. So, there are different causes of myopathy. It might be due to inherited causes or it might be due to acquired causes. Inherited means which is present by birth, and acquired which is acquired during lifetime. It can also be divided into proximal myopathy, or distal myopathy, and regional myopathy. So, what is proximal myopathy? In any of the four limbs, if the muscle weakness or muscle pathology is present in the proximal part, like in the arms or thighs, it's proximal myopathy. And if it is present in the distal parts, like hands and foot, it's called distal myopathy. Sometimes the myopathy might be regional, like somewhere in the face or somewhere in one finger. So it is regional myopathy. We can classify the myopathies as inherited and acquired, as we have already seen in the previous slide. So, what might be the causes of hereditary myopathies? It might be due to muscular dystrophies. Everybody of you have already heard the name of Ducheney's and Becker's muscular dystrophies. Likewise, there are other muscular dystrophies which are the causes of hereditary myopathies. Similarly, myotonias, channelopathies, mitochondrial channelopathies, congenital myopathies, metabolic myopathies, mitochondrial myopathies. And in acquired, the acquired disease can be inflammatory myopathy. So, in the top of the acquired myopathies comes inflammatory myopathy. Other myopathies might be endocrine myopathies, like in some of the endocrinological diseases, like hypothyroidism and Cushing syndrome. Myopathies can be present. So, it's called endocrine myopathies. Uh, uh, I guess all of you have already heard acromegaly, right? So acromegaly is one of the causes of myopathies as well. It is one of the endocrine disorders, and there are other systemic illness which is associated with myopathies. Many chronic diseases, even chronic obstructive pulmonary disease (COPD), is sometimes associated with myopathies. Drug-induced myopathies, drugs like steroids and antiretroviral drugs, and there are other drugs like hydroxychloroquine which can cause myopathies, and sometimes it is due to some toxins. We come across all of these things. So these are the causes of proximal myopathy. In the initial slide, we have already seen what is proximal myopathy and what is distal myopathy. So the causes of proximal myopathies might be inflammatory cause like polymyositis, dermatomyositis, and inclusion body myositis. We will come across these diseases in upcoming slides. Endocrine and metabolic causes may be hypothyroidism, hyperthyroidism, acromegaly, Cushing's syndrome, Addison's disease, Cohen's syndrome, osteomalacia, hypokalemia, and hypercalcemia. So these are the endocrine and metabolic causes. Some toxins are associated with muscle weakness. Right? के हुन्छ कमजोर भयो भन्छ हात खुट्टा कमजोर भयो हिड्न सक्दैन सिडी चढ्न सक्दैन बसेर उठ्न सक्दैन these are the features of proximal myopathy. So toxins like alcohol, amphetamines, cocaine, and heroin, vitamin E toxicity, organophosphates, snake venoms, these are the toxins associated with myopathy. Drugs like corticosteroids, statins, amiodarone, chloroquine, beta blockers, opiates, cyclosporine, vincristine, clobhydrate, and zidovudine. These are the drugs associated with muscle weakness and paraneoplastic syndromes like carcinomatous neuropathy and dermatomyositis. These are the causes of acquired proximal myopathy. हिँड्न गाह्रो हुने बसेर उठ्न गाह्रो हुने proximal myopathy को features हो. These are the muscular dystrophies. There are many muscular dystrophies. These are only some of them. Myotonic dystrophy, proximal myotonic myopathy, Duchene's muscular dystrophy, Becker's, limb-girdle, facioscapulohumeral, oculopharyngeal, Emery-Dreifuss. So these are the different muscular dystrophies. You should know these things. These are the features, muscles affected and other features. So you should go through this. We are not going into details of these muscular dystrophies. Likewise, there are other inherited disorders of muscle metabolism like carbohydrate metabolism and lipid metabolism. So these are the myocardial disease. Yeah, I'm sure that you have already heard this kind of disease, the name of this disease in biochemistry in your basic science, Pompe's disease and carnitine palmitoyl transferase deficiency. Another one is mitochondrial syndromes. So mitochondrial myopathy, we call it mitochondrial myopathy. These are the channelopathies, the sodium channel associated, chloride channel associated, calcium channel associated, potassium channel associated, and renin receptor associated. So these are the disease names: paramyotonia congenita, potassium aggravated myotonia, hyperkalemic periodic paralysis. You should know the name of this disease: hyperkalemic periodic paralysis and hypokalemic periodic paralysis. And chloride channel, Thompson's and Becker's disease. So you guys must be confused. What is neuropathy and what is myopathy? Difference between them is very important. So what is the difference between neuropathy and myopathy? Neuropathy भनेको nerves को abnormality, nerve को pathology. Myopathy भनेको muscle को pathology. The name itself describes the thing. So this question is very common even in your final exam. यो क्वेशन तपाईहरुलाई रिपिटेडली आइराख्छ क्लिनिकलमा तपाईहरुलाई टिचरहरुले सोध्ने क्वेशन एकदम कमन क्वेशन हो न्यूरोप्याथी र मायोप्याथी कसरी डिफरेन्शिएट गर्नुहुन्छ इन न्यूरोप्याथी द प्याटर्न अफ वीकनेस इज डिस्टलमा पहिला हुन्छ वीकनेस समटाइम्स डिस्टल एन्ड प्रोक्सिमल वीकनेस एकैचोटी पनि हुन सक्छ सो डिस्टल न्यूरोप्याथी सुरुमा हुन्छ मायोप्याथीमा प्रोक्सिमल muscle weakness is common usually. So reflexes के हुन्छ deep tendon reflexes neuropathy मा weak or absent हुन्छ तर myopathy मा it is normal early on पछि गएर बिस्तारै muscle काम नगरेपछि deep tendon reflexes might not be visible. Sensory symptoms is present in neuropathy. Sensory symptoms भनेको के हुन्छ? कस्तो खाले symptoms हुन्छ एकजनाले भन्नुस् त sensory symptoms भनेको? What are the sensory symptoms? कति सबैजना सुतिसकेको हो?
Tingling sensation.
Tingling, numbness. Okay,
Numbness.
these are the sensory symptoms. So neuropathy ma sensory symptoms might be present, and in myopathy sensory symptoms might be absent. कति जना कृष्ण शंकर यादव छ तपाईहरुकोमा? 4-5 जना कृष्ण शंकर यादवले सचिन एकपल्ट कल गरेर भनिदिनुस् तपाईको फ्रेन्डलाई.
Sir.
Some of the muscle enzymes like creatine kinase are elevated in myopathy. Other abnormalities might be increased in LDS, and these are normal in neuropathy. EMG ma neuropathy ma neuropathic changes huncha ra myopathy ma myopathic changes. So you need to know EMG ma ke changes huncha, neuropathy ma ra myopathy ma ke changes huncha. Myopathy ma usually short amplitude waves huncha, fibrillatory waves huncha, and muscle biopsy ma group atrophy huncha. Neuropathy ma, myopathy ma specific finding भनेको necrosis हुन सक्छ र inflammation हुन सक्छ. Okay, so these are the common presenting features of all the myopathies, not specific to any inflammatory myopathy, not specific to muscular dystrophy, channelopathies, mitochondrial myopathy, but these are the common presenting features. These include weakness. सबै patient को weakness हुन सक्छ. Muscle को केही pathology छ भने weakness हुन सक्छ. Another one is fatigue. Another one is exercise intolerance, muscle atrophy, myalgia भनेको muscle pain, cramps, muscle cramps, muscle contractures, myotonia, and myoglobinuria. Only in some cases. Rhabdomyolysis भयो भने myoglobinuria हुन सक्छ. So this is a case presentation. Let's see कसले answer भन्न सक्छ. A 44-year-old female presented with hyperpigmented erythematous rashes all over her body, along with V-shaped rashes on the neckline since 2 months. Initial symptoms, as mentioned by the patient, included itchy rashes and photosensitivity. She had progressed symptoms like muscle pain, especially in the left arm and thigh, unable to walk upstairs, inability to stretch hands, inability to turn neck, and difficulty in swallowing food. Like 44 years old female, rashes लिएर आयो. उसको हिस्ट्री हामीले फर्दर हेर्दाखेरि मसल पेन पनि थियो, इनएबिलिटी टु वक अपस्टेयर्स, सिडी चढ्न सक्दैन थियो, ह्यान्ड स्ट्रेच गर्न सक्दैन थियो, घाँटी हल्लाउन सक्दैन थियो बिकज अफ हर विकनेस, एन्ड खाना निल्न सक्दैन थियो. सो ल्याबोरेटरी फाइन्डिङ्स हामीले हेर्यौं. ESR 30 थियो, CRP रेज थियो, ल्युकोसाइटोसिस थियो, न्युट्रोफिलिया पनि थियो, सिरम क्रिएटिनिन काइनेज 17,160 मार्कली एलिभेटेड. लिभर इन्जाइम्स पनि ALT र AST इन्क्रिज थियो अनि LDH पनि इन्क्रिज थियो. सो व्हाट इज द डायग्नोसिस? What is the diagnosis? The disease is dermatomyositis, muscle weakness plus skin lesions, dermato and myositis. Okay, हामी अब what is dermatomyositis हामी हेर्छौं है त. So these are the disease associated with inflammatory myopathy. Let us go back to this slide. So we can see what are the inflammatory myositis in the first one. In the second column, second row, that is polymyositis, dermatomyositis, and inclusion body myositis. So we will only go through these three diseases today. Polymyositis and dermatomyositis. So these are the disease with some inflammatory processes affecting skeletal muscles. Skeletal muscles ma केही inflammation भयो. Inflammation, we don't know what is the cause, right? Skeletal muscle ma inflammation भयो. It might be due to genetic cause, environmental cause, similar in the way in which SLE occurs, lupus or any other autoimmune disease occurs. So you पनि एउटा autoimmune disease हो, inflammatory process affecting skeletal muscle. In dermatomyositis, characteristic skin changes also occur. Incidence एकदमै थोरै छ, 2 to 10 cases per million per year. एक वर्षमा 1 million मा 2 देखि 10 मात्र हुन्छ. But the result is very devastating because सबै मसल weakness को पेशेन्ट बेडरिडन हुन्छ, पेशेन्टले swallow गर्न सक्दैन, पेशेन्टलाई ब्रिदिङ डिफिकल्टी हुन सक्छ रेस्पिरेटरी मसल weaknessले गर्दाखेरि. And it might occur in association with other autoimmune disease. The cause is unknown, although there is evidence of genetic contribution. So clinical features ma age of onset 40 to 60 years of age, females ma धेरै हुन्छ as the disease is autoimmune, and there is presence of symmetrical proximal weakness, usually affecting the lower limbs more than the upper limbs. Upper limbs भन्दा बढी thigh weakness धेरै हुन्छ, त्यही भएर पेशेन्टले स्क्वाटिङ पोजिसनबाट म उठ्न सक्दिन भन्छ. सबभन्दा कमन सिम्पटम पेशेन्टले लिएर आउने भनेको म बाथरुममा बसेर उठ्न सक्दिन, स्क्वाटिङ पोजिसनबाट उठ्न सक्दिन. And it has a gradual onset over a few weeks. There is difficulty rising from a chair, climbing stairs and lifting, sometimes in combination with muscle pain. Muscle pain पनि हुन सक्छ. Systemic features of fever, weight loss and fatigue might be present. Respiratory or pharyngeal muscle involvement can lead to ventilator failure or aspiration. The disease is sometimes life-threatening. Respiratory and pharyngeal muscle involvement, patient cannot swallow, patient cannot take, patient cannot breathe, and sometimes ventilatory support might be needed. And interstitial lung disease, orco factor where interstitial lung disease occurs in up to 30% of patients of this kind of disease. These are the features which is common to both polymyositis and dermatomyositis. So the name itself explains myositis, inflammation of the muscles. Okay, there are some pictures I'm going to show you. You kiko picture hola. This is the picture showing proximal myopathy. Proximal myopathy, thigh ko muscle wasting cha. Arms को त्यति देखिदैन तर thigh को muscle wasting छ. In dermatomyositis, skin lesions might also be present. These are the name of some skin lesions. Gotron's papules. So there are some papules in the knuckles of both hands. There's like Gotron's papules भन्छ. Heliotrope rash, periorbital erythematous rash like heliotrope rash भन्छ. V sign in the neck, neck ma V sign huncha. Sol sign भन्ने हुन्छ. Sol ओर्ने ठाउँमा, back ma, upper back ma rashes हुन्छ. Sol sign हुन्छ. Holster sign भन्ने हुन्छ. Thigh ma rashes हुन सक्छ. Mechanics hands हुन सक्छ. Raynaud's phenomenon, that you already know, sequential color change of the fingers, and fingertip ulcers or malar rash can also be sometimes be present. So this picture shows Gotron's papules. You can see only in the knuckles. Knuckles macha over the PIPs, over the MCPs, metacarpophalangeal joint ko mathipati. Ani overlying which joint? PIP, proximal interphalangeal joint. You can also see some changes in the nail beds. So these are typical features of dermatomyositis. This is the heliotrope rash, right? Periorbital rash. Sometimes it can be confused with malar rash. Cheeks ma pani cha haina. This is the Sol sign. Sol orne area ma rashes cha bhane Sol sign. This is the V sign. Neck ma V cha bhane this is the V sign. This one is mechanics hands. Scaly rashes. Usually lateral surface of index finger ma matra huncha. मैले तपाईहरुलाई जस्ट एउटा स्केली र्याश को इम्प्रेसन देखाउनलाई मात्र यो पिक्चर राखेको हो. So in dermatomyositis and polymyositis, there is threefold increased risk of malignancy. And dermatomyositis might be a part of paraneoplastic syndrome. So even in other malignancy, dermatomyositis can be present, and presence of dermatomyositis has also threefold increased risk of other malignancies. Most common being lung malignancy, त्यसपछि breast, ovaries, जहाँ पनि हुन सक्छ. What are the investigations you want to do in this kind of myositis, muscle go inflammation ma? We request blood counts increase, total count huna sakcha, WBC counts. Inflammatory markers like ESR and CRP might be increased. Blood biochemistry, liver function test and renal function test, especially liver function test ma transaminases AST, ALT increase bhako huna sakcha. Muscle biopsy is the gold standard and it shows the typical features of fiber necrosis. Muscle fiber necrosis हुन्छ, muscle fiber degeneration and regeneration, and muscle ma inflammatory cells infiltrate हुन सक्छ. MRI can sometimes be useful, inflammation rule out गर्नलाई. Serum level of creatinine phosphokinase, transaminases and LDS are usually raised, and EMG can confirm the presence of myopathy and exclude neuropathy. Neuropathy or myopathy, दुईटाको symptoms एउटै हुने भएकोले कहिलेकाहीँ we can get confused, so EMG गरेर we can confirm it. So management के गर्ने, general regular physical exercise, avoidance of drugs causing myopathy, and patient education. And medicines might we can use oral corticosteroids, that is prednisolone, 1 milligram per kg daily, or sometimes in case of muscle weakness, we can try high dose of steroids like high dose intravenous methylprednisolone 1 gram per day for 3 days. Other medicines that can be used are azathioprine, methotrexate, these are the disease modifying drugs, cyclosporine, cyclophosphamide, tacrolimus, or MMF, mycophenolate mofetil. These are the alternatives, and sometimes in refractory cases, intravenous immunoglobulin can be given. Intravenous immunoglobulin, severe muscle weakness छ भने पनि हामीले कहिलेकाहीँ ट्रायल गर्न सक्छौँ. यो टर्म तपाईहरुलाई कमन नै छ, इन्ट्राभेनस इम्युनोग्लोबुलिन. अहिले कोभिडको बेलामा पनि ट्राई गरेको थियो, यसको धेरै रिसर्च छ. The next disease is inclusion body myositis. So यो disease polymyositis र dermatomyositis भन्दा अलिकति डिफरेन्ट छ. It occurs in patient aged 40 or more, and it is more common in men. It is also inflammatory disease of the muscle associated with accumulation of abnormal protein aggregates. So that's why it's called inclusion body myositis. Distal involvement is more usual and maybe asymmetrical. Right hand or right hand मात्र involve हुन सक्छ, left lower limb, left leg मात्र involve हुन पनि सक्छ, and distal part fingers को grip मा problem हुन सक्छ. In investigation is same as for polymyositis and dermatomyositis, and typically reveals slightly elevated creatinine phosphokinase and both myopathic and neurogenic changes on EMG. Muscle biopsy shows abnormal fibers containing rimmed vacuoles and filamentous inclusions in the nucleus and cytoplasm. Treatment is specific treatment, but treatment can be tried with high dose corticosteroids, immunosuppressants, and immunoglobulin as described for polymyositis, but therapeutic response is often poor. So that's it. That's all about myopathies. You need to learn on more specific things like difference between myopathy and neuropathy. What are the causes of myopathies? What are the causes of proximal myopathy, and what are the causes of distal myopathies? What are the causes of regional myopathies? यो कुरामा अझ तपाईहरुले फोकस गर्नुपर्ने हुन्छ. Okay, thank you. Any questions? Questions, okay? Sachin? Sachin?
हजुर सर
केही छ तपाईहरुको क्वेशन?
छैन होला सर
ल ओके थ्यांक यू
थ्यांक यू सर
Sir.
Thank you, sir.